Hi, this is the second video on cardiovascular disease, and I will be talking about various risk factors involved, and how these can be reduced. There are several risk factors that can increase the chances of getting CVD. Having more risk factors usually means there is a greater risk of developing CVD. Reducing or eliminating these risk factors can significantly improve overall health of a person. This is the primary goal of raising awareness for the public so that everyone can take certain actions to tackle these modifiable risk factors. As well as improving health outcomes for everybody, this can also greatly reduce the burden on healthcare systems. There are many risk factors that can be addressed to prevent the development of CVDs. Hypertension or high blood pressure is one of the most important risk factors for CVD. High blood pressure can cause damage to blood vessels over time. Smoking and other tobacco use is another very important risk factor for CVD. Smoking can cause damage and narrowing of blood vessels. This is a completely modifiable risk factor, and public awareness plays a crucial role in helping people to quit smoking. High cholesterol from fatty and unhealthy foods can cause narrowing of blood vessels, and increase the risk of developing a blood clot. Diabetes is characterized by high sugar level in the blood. High blood sugar levels can damage the vessels, leading to narrowing. Obesity or being overweight is another modifiable risk factor for developing CVD, and also for diabetes and high blood pressure. Chronic kidney disease is a long-term condition that some people suffer from. This can increase the risk of getting CVD. Sedentary lifestyle and inactivity can lead to being overweight, high blood pressure and high cholesterol, all of which would increase the risk of CVD. The other risk factors for developing CVD include positive family history, South Asian and Black African or African Caribbean background, being over 50 years of age, male gender, excessive alcohol consumption, and air pollution. Risk factors such as family history, ethnicity, age and gender cannot be modified. However, other risk factors are modifiable, and a healthy lifestyle can lower the risk of CVD. Stopping smoking is one of the most beneficial steps that a person can take to reduce the risk of CVD and improve their overall health. If this is challenging, there is help available through pharmacies and doctors. A healthy, balanced diet is recommended for a healthy heart and body. It is advisable to reduce unhealthy saturated fat found in fatty cuts of meat, lard, cream, cakes and biscuits, and instead to consume healthier fat that is found in oily fish, nuts and seeds, and olive oil. High amounts of salt in diet can lead to high blood pressure. The general advice is to aim for low levels of salt, and this should be less than 6 grams or 1 teaspoon a day. A balanced diet should also include plenty of fruit and vegetables, lots of fiber and whole grain foods, and low levels of sugar. Regular exercise and maintaining a healthy weight can improve overall health and reduce the risk of developing CVD later in life. If there are difficulties with losing weight, it is best to see a doctor in person as they can arrange a visit to specialized weight management clinic. Excessive alcohol consumption should be avoided, and the current recommended limit is 14 alcohol units a week for men and women. Air pollution is an environmental risk factor, and it is advised to avoid heavily polluted areas and to wear a face mask. People with confirmed high blood pressure and high cholesterol may require treatment with medications. Identifying those at highest risk of CVDs and ensuring they receive appropriate advice and treatment can prevent premature deaths. This is why public awareness and prevention is very important.